Long 9, Taiyuan, Supreme Abyss, a 5-Shu point, specifically a Shu-Stream point. Long 9 is located on the ventral aspect of the wrist at the level of the wrist joint space, which is the most distal wrist crease, on the radial aspect of the radial artery and ulnar to the tendon of the abductor pollicis longus muscle. How to find lung 9? As the location of the wrist crease varies, the ventral joint space between the proximal row of carpals and the radius ulna is a more reliable landmark for orientation. By loosely moving the hand, the joint space is easily palpable. Palpate the radial artery pulsation on the radial side and locate lung 9 on its radial aspect. Located on the same level are pericardium 7 between two tendons and heart 7 radial to the insertion of the tendon of the flexor carpi ulnaris on the pisiform bone. Needling of lung 9 is done vertically 0.2 to 0.5 soon. Caution, avoid radial artery. If the needle is pulsating, which is the desired effect, no additional stimulation is needed. Actions or indications of lung 9: strengthens the lung, transforms phlegm, descends lung qi, regulates and harmonizes vessels, which is the relationship between zong qi and blood circulation, opens the channel, alleviates pain. Special features of lung 9: Yuan-Source point, Shu-Stream point, earth point, tonification point, Hui meeting point of the vessels. An important point for tonifying lung qi and yin, especially with chronic disorders. Lung 9 is the Shu-Stream, Yuan-Source, and earth point of the lung channel. The spiritual pivot in chapter 6 recommends the use of Shu-Stream points in treatment of disorders of the Zang. Whilst in chapter 1, it says, when the 5 Zang are diseased, select from the 12 Yuan-Source points. Furthermore, the classic of difficulty states, in cases of deficiency, reinforce the mother. According to 5-phase theory, lung 9 is the earth and thus the mother point of the metal Zang. Lung 9, therefore, is the single most important point on the lung channel to tonify lung qi or yin, the two principal patterns of lung deficiency. Lung 9 is indicated for lung deficiency characterized by chronic weak coughing or wheezing. In the case of lung qi deficiency, there may also be shortness of breath and much yawning, whilst in the case of lung insufficiency, there may be heat in the palms and spitting of blood. Lung 9 will also assist in transformation of phlegm, which arises due to deficiency. If lung qi is too weak to move the fluids in the lung, there may be copious watery phlegm. Whilst if lung yin is deficient and the consequent heat condenses the fluids, there may be scanty dry phlegm with dryness of the throat. As well as tonifying deficiency, lung 9 promotes the descending function of the lung and is indicated for fullness and oppression of the chest with inability to lie down. According to the classic of difficulties, the vessels gather at lung 9, whilst the classic of category states the flow of the channels must follow the qi. The qi is dominated by the lung, therefore, it is the meeting of the 100 vessels. These statements refer to the important relationship between qi and blood, expressed in the saying that qi is the commander of blood, and the further statement in the classic of categories that the vessels are the pathways of the blood qi. The circulation of the vessels is dependent on qi. In other words, the blood moves through blood vessels by virtue of movement of qi, and in the chest and heart region, especially, the circulation of blood depends on the gathering qi formed from combination of air inhaled by the lung and the grain qi of food and drink. Lung 9, the Hui meeting point of the vessels, is therefore an important point to harmonize relationship between gathering qi and blood. When gathering qi is deficient and fails to circulate blood, it will pool and stagnate in the chest and heart, giving rise to oppression and fullness, agitation, heart pain with a choppy pulse, and in severe cases, manic raving. Lung 9 is further indicated for disorders of blood vessels in general, such as vomiting, spitting, or coughing blood, and pulseless syndrome. The lung channel has its origin in the middle jaw, and in common with many points of the channel, lung 9 harmonizes the stomach, being indicated for rebellion of stomach qi with belching, as well as for stomach channel heat symptoms, such as toothache, superficial visual obstruction, redness and pain of the eyes, and breast pain. Lung 9 is indicated for pain affecting various portions of the lung channel, including supraclavicular fossa, shoulder and back, inner aspect of the arm and wrist. It should be noted that the Chinese reference to the inner aspect of the arm in respect of the lung channel assumes a standing posture with the palms hanging facing the sides. In terms of the Western anatomical position used by most medical textbooks, the lung channel occupies the anterolateral position on the arm.